Let's look now at the dental clinical signs and symptoms and sum up this chapter. So, dental clinical signs and symptoms, you could expect to see in a patient that has obstructive sleep apnea, nocturnal bruxism, evidence of it, scalloping of the tongue around. I'm going to show you some images in a minute. Dentinal pooling associated with a gastroesophageal reflux GERD or GORD, whichever way you want to pronounce it. Okay, here we go. This is this type of thing that you'd see attrition going on there, and you'd want to ask the question. This is an opening for you to say, do you snore? You know, what's going on? And are you undergoing treatment for obstructive sleep apnea? Now, there's a significant amount of wear going on there. You'd certainly be looking to assess this patient for sleep-related breathing disorders. Screen them. And here we go, beautiful example of tongue scalloping. Now, I don't know if you can actually see on the teeth there, they're really quite flattened. And again, dentinal pooling. This is evidence of acid erosion. And there we are from a palatal perspective. Gastroesophageal reflux disease and what it does to the teeth. You'd have this because as the patient is trying to inhale, and the airway is blocked, they'll actually start to pump up the acid from their stomach. It bypasses, it goes through the cardiac sphincter and actually comes up their esophagus and burns them, and gives them halitosis as a symptom. Yeah, perhaps you pick that up as well. So in summary then, we've covered healthy sleep. We've looked at the theories and functions of sleep. We've looked at how obstructive sleep apnea and obstructive sleep apnea syndrome are diagnosed. And we've looked at the typical dental clinical signs and symptoms.